Do you or someone you love have a diagnosis of scoliosis? Well, my name is Paget, and today I'm going to uncover one of the most important keys to avoiding scoliosis surgery that has helped hundreds of my clients. By the end of this video, you will have a better understanding of this condition, the alternatives to invasive surgery, and be able to make informed decisions about your path forward with your scoliosis. In this video, I'm going to highlight the problems with the current model of the treatment of scoliosis and then share with you two effective methods for non-invasive treatment of this chronic issue. Be sure to stick around for all three parts of this video because together they create a powerful holistic method for you to utilize at home to potentially avoid a life-altering surgery. Now, the shock of discovering a scoliosis can be very sudden. When a teenager or a preteen gets scoliosis, it feels like it comes on overnight. One day it isn't there, and the next day it is. Of course, it doesn't actually happen that quickly, but when a parent notices it for the first time, it sometimes feels like it does. Now, for adults, the story is a little bit different. Most of them know they have some form of scoliosis as they are growing up, but as they age, it can start to get worse, especially in women over the age of 50. As a reminder, scoliosis is a condition that causes the spine to curve to the side and rotate. It can affect any part of the spine, but commonly it affects the chest area, which we call a thoracic scoliosis, and the lower back, which we call a lumbar scoliosis. Now, the term idiopathic scoliosis, which is common in teenagers, means it has no known cause, although there are some theories as to why it might start, and I'll link some references in the description below for you to explore in your own time. But scoliosis presents a unique set of challenges, particularly affecting self-esteem and confidence. Now, people who have scoliosis notice that their appearance changes, and they can experience things like uneven shoulders, a rib hump on one side, uneven hips, and a shifted waist and trunk. The good news is a mild scoliosis doesn't necessarily cause significant health issues, but in severe cases, where the curvature reaches a Cobb angle of around 80 degrees, it can actually compress the lungs and heart, and this does pose serious health dangers. So teenagers, apart from the physical changes, often experience no symptoms, but as they age, the scoliosis can bring pain, stiffness and fatigue into the back, and those symptoms can slow down their activity levels and diminish their overall quality of life. But for most people, the first person they're going to talk to about their scoliosis is their doctor. Now, the doctor will usually give them three options. Now, number one is wait and see what happens. And this means they're simply just going to wait and see if the curve progresses to get bad enough for option number two, which is bracing, and then if it continues to get bad, they'll be given option number three, which is surgery. That's pretty typical of modern medicine. They have to start somewhere, but it doesn't take into account all the other types of therapy that they could be doing right now. You see, waiting and seeing means that they're going to get x-rays 4 times a year, and as an adult, it might be actually 1 every 4 years. But basically, the doctor is just going to wait for that curve to progress so that they can hit a certain threshold to be able to offer you the bracing or surgery. Now, in the past, surgery actually involved opening up and putting rods either side of the spine and fusing it so that the spine doesn't continue to move, but it had complications, meaning that the rods would sometimes snap. And as the spine was fused, people couldn't move their back for the rest of their lives. So areas above and below it would wear out due to arthritis. Having said that, modern techniques are getting better at managing this, but they still don't always work. But there is one technique which I think shows a lot of promise, and that's called vertebral tethering. Now, unfortunately, it's not a widely practiced surgery, and it might not be available in your country, but I'm going to put a link to that in the description below as well, because it's well worth checking out. But every year, hundreds of people commit to these surgeries, which can cause more pain, as I mentioned, and sometimes they're not even necessary. And as an osteopath, this is extremely difficult for me to watch, which is why I want to share with you multiple approaches that you can do from home that will greatly decrease your chances of your scoliosis getting worse. First, let's look at bracing in a bit more detail, because it's been shown to be a powerful tool in halting curve progression. Now, this study, called the BRACE study, focused on people who had a curve of between 20 and 40 degrees. And they showed that 75% of the participants who wore a brace for 13 hours or more a day stopped the curve progression to under 50 degrees. Now that's compared with just 48% of the control group who didn't wear a brace. Now this shows that for the right person, bracing can be very effective at stopping that progression, but it does mean that your child has to wear a brace for extended periods of the day. Now in my experience, most teenagers just simply refuse to do that. This brings me on to one of the most underused non-invasive techniques for scoliosis, and that is exercise. You can exercise in combination with bracing or by itself, and it can slow down and even stop the progression of the curve. But exercise in some, but not all cases, has also been shown to reverse the curve. For example, Charlotte, who was 12 years old, used the scoliosis correction protocol and in just 3 months managed to reduce her curve from 25 degrees to 15 degrees. Likewise, Fabi, who worked remotely from Peru with an interpreter to understand the English language videos, managed to reduce her curve in the upper back by 18% and in the lower back by 31%, and she did that in just 3 months. Scoliosis-specific exercises can be done under the supervision of a kinesiologist, a physiotherapist, osteopath, or even a chiropractor. Or as we like to do it, it can be done remotely, which means my clients don't have to spend hours driving backwards and forwards from appointments and have to battle traffic, find parking spaces and pay for parking spaces, and also take time out of their already busy days. They can do it all from the comfort of their homes. Now, another thing you may want to consider, depending on your age, is dietary changes or supplements that may actually help correct some of the deficits in neurotransmitters that have been shown to exist in people with scoliosis. For example, this chapter in the book Serotonin showed that normal serotonin levels are actually altered in people with scoliosis. Some researchers say that eating specific foods that are high in tryptophan, which is a precursor to serotonin, can actually help. So look for foods like salmon, chicken, eggs, and spinach. Some of my clients have actually asked about passive therapies like hands-on physiotherapy, chiropractic and massage, and even acupuncture. Now, all these things can play a role in the symptom management of scoliosis, like back pain and stiffness, but they haven't actually been shown to reduce the curves just by themselves. All right, the takeaway from this video is that your doctor may make it sound like your only options are bracing and surgery, and they're going to focus on the angle of your curve to make that decision. But what I wanted to show you here is that there are other options, including food and specific exercises, which essentially are free. They're non-invasive, they're good for your bone, good for muscles, and even your brain health. And in the case of specific exercises, they can actually slow down, stop, or even reverse your progression of the curve. If you're looking to take these techniques even further and learn other impactful methods of holistically managing your scoliosis, I'd like you to reach out to me directly via the link in the description below. I'd love to connect with you and discuss the best path forward for your health journey. As always, make sure you like and subscribe if you found this beneficial, and share with someone you love who might be impacted by this chronic condition. Have a great day, and I'll see you next time.